I think that we talk about kind of vaccine hesitancy, we talk about, you know, access, whatever, but having a bunch of us having worked these clinics week after week after week, we get people that come in that say, I wouldn't have come if there wasn't a clinic like this, which is weird to say because it's almost hard to believe, but so many people said that. Or someone on the phone who's like, I have an appointment, but sorry, Belan, I don't think I'm gonna go actually. And this is like a prominent member in our community who's like doing all this work for us, and then he's like, I just don't feel comfortable. I don't feel safe. I don't want to do it. I didn't want to do this from the beginning. Thank you for your time. And I was like, just come in and see what it's all about, because at the door, you have Luis at the door, hanging out with people, chatting with them, seeing what their questions are. There's music there. You come in, there's snacks, there's people who look like you. You talk to Weiwei, you check in at the front desk. She's checking in with you to make sure you have everything you need. And then whatever, if you don't feel good getting your vaccine in this big room with a lot of people, there's a back room and we can hold your hand while you do it. And there are people who almost broke my hand. And I think that people felt that and that they carried that with them. And then I guess I just want to say that the clinics then became a community center where some people would come back even though there wasn't even time for their second dose. But they come back. Gary Scott, who works for UVMMC and was really new to town, a black man who was really high up in this institution, new to town, didn't really know anyone, didn't really have a whole lot of friends, came back every Saturday just to hang out with us and met a lot of people through that. And people, you know, started talking about, hey, maybe this is a business idea we can do together. Hey, I'm opening a restaurant after COVID's done, come to it. Like, it became a community center where there all this other innovative, these ideas are being generated. So in addition to people getting what they needed to kind of be safe, they also got a lot of this community support that we didn't see for the year plus of COVID being so intense.
Or people in general.
Yeah. And then the second part of your question, all of that, the Vermont Health Equity Initiative came out of COVID. It's one of the, just like Language Justice Project, people were able to come together and we're able to have that now. This initiative, we learned a lot from COVID and how to do healthcare better, and all of us learned that. We're trying to apply those same principles to other major health equity issues that are maybe not as intensely dramatic as COVID is, but things like mental health. The COVID pandemic happened, people are isolated, substance use disorder is at an all-time high in the area, whatever, all these things that come out of it, isolation. Now mental health is another big thing that we have to talk about. But we have to remember that that's also an emergency now, and now we're trying to shift our focus to how do we solve other health equity problems in Vermont as a BIPOC-led organization trying to serve BIPOC people.
I agree with everything. I think community building, people realizing that they can go to a place and they are people who can give them the services that they need in that space. They can get the support. And I think what was beautiful for me was seeing people coming as communities, as family rather, coming in as family to get vaccinated. And sometimes after conversations back and forth of explaining what this vaccine looks like, of saying nobody really knows anything about it. We have very little trials out of it, but these are results that at least now show that there's some level of immunity if you get vaccinated, and people trusting us with that information, right? And then I think what also I came out of this is some of us coming from backgrounds where so many trials were done on us without any information whatsoever. You can imagine what that may bring back, kind of memories, right? And then having the opportunity to say, okay, that's part of the history and it's not going away, but now we are trying to look at how do we do this in such a way that we are not the guinea pigs, you are not going to be the guinea pig, everyone else is getting this vaccine. And then creative modes, I have to say shout out to my colleague Carabo, who we had to use our creative juices, produced a song, Chanjo. If you haven't listened to it, just Google Chanjo. It came out of that message of, people talking about vaccine in different ways. So it's going to kill you. You'll never have children if you do this. And us then working together, really, I think, strengthening our capacity as small organizations serving minority population. USCRI, formerly known as VRRP, AALV, everyone, new organizations forming, and then us coming together and saying, we gotta do this together. to provide services. I think that's huge. And then really other services like mental health services now saying, we realize the importance of this. How do we do this together? And I think the beauty of everything is that there's hope, right? Conversations are ongoing, and there is hope to that if we continue in the same lane, something should work out. We just have to be patient with each other. It's not gonna happen overnight. That's the reality of the work. It's hard work, but if we stick together, we will make a difference.
Yes, it was the positive that came out of this is community, like with the BIPOC people coming in to be able to and be able to see another BIPOC person there, just to hang out with a community of people that they didn't even know existed. You know, they didn't know that everybody was there. They was like, "Where'd you come from? Like, where'd you come from?" And they would just come in and we had people just coming in, you know, on the days that we were doing the clinic just to come hang out, just to be a sense of community. And it kind of sparked more community outreach. I'm also the health chair for the Rutland area NAACP. So, you know, it sparked more things, and I ended up starting we started a hair clinic in 2021, but it really didn't do a whole lot, and I kind of took it to the next level, and now people come to my hair clinic just to be around other BIPOC people. You know, they not necessarily getting their hair done, but they just come just to be around BIPOC people. And so it's created more of a sense of community and giving us a newfound kind of safe place to feel comfortable and want to be taken care of. I've found that working at the hospital that I have more BIPOC people coming into the hospital to be treated, to go to the clinics, to go to the doctor, because they have a BIPOC face, you know, more BIPOC faces to know that, you know, it's somebody in there that do care, and somebody that will talk for them and help them if needed.